In this special feature episode of Talking HealthTech, I'm here at HIMSS 2025 in Las Vegas. I'm joined by thousands of other digital health innovators and experts from across the US and around the world who've come together to learn about the latest in AI, interoperability, cybersecurity, patient engagement, and new models of care. So here at HIMSS, I'm in my element on Podcast Row, recording conversations with some unique minds to talk about not just what technology can do, but what healthcare needs. So you'll catch a handful of the conversations that I had here at HIMSS in this episode of the podcast, but there's plenty more where that came from. So head over to our YouTube channel where you'll find a playlist of all the conversations that I had here at the event. The link to that is in the show notes of this episode. Collaboration starts with a conversation, Team HealthTech. Let's make it happen.
I'm Hal Wolf, President and CEO of HIMSS, and it's great to be here in beautiful Las Vegas for HIMSS 25 Global Health Conference and Exhibition.
Yeah, it's amazing to have you here as well, here on Podcast Row. It's great to be able to have the conversations here on the floor. So thanks, Hal, and the team for pulling everything together. It's been a great conference. We're kind of in the thick of it right now, having this conversation, but still a lot more to come. But hey, there's been a lot of HIMSSs under the belt and a lot of lead up to this particular one. It seems like there's been a really big turnout and a lot of activity. Like, what's your take on it so far, Hal?
No, it's been a tremendous turnout, actually. We're well ahead of last year, both in terms of total attendance, and what we're most pleased with is I'll use the word surge in professionals that are attending as well. These means people who work inside the healthcare systems. And it's increased two different ways. One in the number of attendees, which is fantastic. And the other is in the badge level, if you would. So we monitor individuals' titles. And we've noticed a lot more decision makers this year than in the past. So we've seen roughly a 15 to 16% increase in the number of attendees on the professional side, which the market suppliers are obviously thrilled with. It takes one quick glance on the second day and you can see all the booths are just as full as they were. Some would say actually fuller even than the first day when they were packed. We're seeing a lot going on, and the educational programs have kicked in. So we're very pleased.
Look, it's interesting. When I think of, we're asked often, it's like in terms of who are the types of people that attend HIMSS, and we know, it depends on what area of healthcare you're in terms of what you know HIMSS for. Some people know it as the annual conference or the conferences in different parts of the world. Others obviously know it on the standard size and the HIMSS levels of hospitals and many that are part of the different chapters and societies in different parts of the world. Do you find that the event is kind of, just the society event? It feels way bigger than just, people who are actively doing things on a day-to-day with HIMSS. It feels like the whole healthcare ecosystem.
Oh, it is. So, look, you used the right word. It's a society. And when the name society was brought together in 1961, when HIMSS was started, they realized even then that healthcare is not one group. It takes it takes a village. And so nurses, physician leaders, technicians, informaticists, government relations. I'll leave someone out, and I don't mean to, right? But it takes every single component of the healthcare ecosystem to be able to drive the change necessary. No one group handles it by themselves. So what HIMSS has been particularly adept at is understanding the segment groups that make up those healthcare pieces and creating educational and programs and thought leadership for them, but most importantly, how that weaves with others. And so when you look across here, you may not be a HIMSS member, but you're benefiting from all the thought leadership. So a great example is our maturity models. And if you go to the one that everyone knows, which is MRAM, right? And it was upgraded. MRAM is used by consulting companies. They tell me this all the time. I build my whole practice around the fundamental strategy and the hierarchy of MRAM because it's tried and true on a global basis. And it's no longer just a technology checklist. I mean, pretty much anyone can do that and put a label on it. We did that in the beginning, and it was an important technology checklist. But now it's about how do you use the technology? How do you deliver the access? How do you deliver the quality? We've done that upgrade now on our infrastructure. We've done that up on maturity model. We've done that on our analytics maturity model, and more to come, right? So this is where we're getting into the deep help strategically and operationally. So whether you're a HIMSS member or not, you've got resources around you. But now with our new gating ability and specialization for our members and our reintroduction of huge value, if you are a HIMSS member, you're going to get access to articles and thought leadership capabilities that non-members don't get. So we'll always be an important source. And by the way, people are coming up to our HIMSS Connect booth and saying, I want to be a HIMSS member. Yeah. That's never even happened before. Okay. I mean, we've had it and people sign up for membership coming in. Yeah. And we've had the largest increase in membership in HIMSS of new people joining this year than we've had in the last 5.
Interesting.
And they're now they were reporting to me as I came early, like people are walking up to the booth and saying we want to be HIMSS members. So we're very excited.
Yeah. Do you think that's because like the value proposition is just super clear, or it seems like a bit of a no-brainer? I feel like there's many, people involved in digital healthcare innovation, just healthcare generally, frontline clinicians, at the rate of innovation and change and new ways of doing things, being able to have access to quality resources and the right communities and the how to do things has never been more important. Am I kind of on the right track here?
No, you're totally on the right track. Listen, I think it's a no-brainer. And I think a lot of people are, well, it's funny. So I came into healthcare 22 years ago. And when I came in, I joined another organization first. And I went to it because I was a CIO and I looked at it. I was like, okay, kind of interesting. But I was working in a very large integrated care system. And, talking to other CIOs, it was kind of interesting. It was good. There's some good stuff there. And then the next year, I stayed a member there, and I went over to HIMSS, and I went, oh, okay. I found what I deal with every day. Yes. I found the doctors, I found the nurses, I found the informaticists, I found the technologists, I found the blend going on that is my everyday life. Yeah. When we would come as a group and we would march this floor, we would go as a team to find solutions to problems we were trying to solve. Because there's no such thing as a technology decision. It's a business decision. It's a care decision. It's a quality decision. It's an access decision. People, process, technology. Technology is super important and we've got to implement it. But what's the so that? Yeah, and what you get out of HIMSS that you just don't get anywhere else is the so that. So the organization itself, as a global nonprofit, provides a lot of strategic thought and direction for individuals. It delivers the so that if you do these things, you're going to get here, with a lot of excellent documentation by thousands and thousands and thousands of hospitals around the world. So it's an invaluable resource.
Yeah. Absolutely. Hey, look, lastly, Hal, appreciate you've obviously got a very busy dance card over the next couple of days, so I appreciate you making the time for this chat, but probably a pretty selfish question as well, given that, look, the audience of Talking HealthTech is indeed global, but strong presence from Australia. As you know, I'm Australian.
Yes.
If you couldn't tell.
What?
But then, increasingly, I mean, there's quite a good Australian contingent here, and we always seem to have a positive aura about us if you can find the Aussies anywhere in the room, right?
No question.
But then there's going to be more after seeing, the content and everything that comes out for next year at HIMSS as well. There's always the question of, well, is it worth the investment coming the other side of the world to be able to come to an event like HIMSS?
Sure.
Given that it could be anywhere from the frontline, even in our group of Aussies, there's the frontline clinicians that have come out to see what's going on. There's health tech providers who are really early stage right through to enterprise, well-known organizations that have come out too. In terms of, determining if it's the right time to make the big trip over to Vegas next year for HIMSS, is there a sweet spot, or is it really there's something for everyone in healthcare to come over?
It's a little bit of both. So is there something for almost everyone in healthcare? Because healthcare is enormous.
Sure.
But I would ask myself just these few questions to answer that question, which is, am I in a healthcare system that is facing a change in the way I need to deliver my services? And if so, is digital health tools and capabilities a critical part of that strategic planning? And if the answer to those two are yes, my next question should be, and how many people should I be bringing with me to come to HIMSS?
Yeah.
And the reason for that is you will not find, and listen, I've been all over the world too. Worked a year and a half in Australia. You know, up and down the East Coast, and a little bit in Western Australia, but mostly, you know how it's laid out.
Yeah.
And you're just not going to find any place in the world or any event in the world where all of that comes together. And you learn as much in the hallways and in the bars and restaurants as you do sometimes in the classrooms. But the buzz here is constantly about where are we going? What did you learn? Did you talk to these people? Wow, did you see that presentation? So those are my three questions I would be asking. And that's why you've seen a huge surge this year from South America as an example.
Yeah.
You know, hundreds from Brazil. Last night I was with people from Colombia. I was with people from Mexico. I was talking down the row a bit, you know, and they were with a big group from the Philippines and Taiwan and Korea. Europe, of course, is extremely well represented. So, no, we're all in this together and we're learning from each other. And by the way, the most advanced system in the world that has the highest number of stage 7s and a perfect score in the digital health indicator is Samsung Medical Center, who was front and center yesterday on stage. It's a global membership, and we're learning from everybody.
My name is Lee Kim. I'm Senior Principal of Cybersecurity and Privacy at HIMSS, the Healthcare Information Management Systems Society.
It's great to see you again, Lee, and 2 years in a row. So doing a conversation here at HIMSS. We spoke last year in Orlando. I was going to say a lot's changed in the last 12 months, but there's things that have changed and things that remain the same as well. You know, your lens very much around the cybersecurity side when it comes to HIMSS. I'd love to get your take on what you've seen in the cybersecurity space over the last 12 months since we last spoke.
What I've seen is ever more increasing velocity of data. Artificial intelligence, of course, is fueling that, as we know. I've seen a lot more reliance, of course, on third parties and, of course, the fragility, as we know, around that with incidents that occur. And last but not least, I've seen an increasing whirl of scams.
We're not sure, the concept of scams is definitely not new.
No.
And are you seeing that there's just a sheer increase in the volume of them or increase in the complexity or the nuance of them, or a little bit of everything?
Everything.
Right.
So, you want me to break it down?
Tell me more.
Let's break it down.
Yeah.
So, as an example, let's say I'm a bad person. Am I a bad person?
You're not a bad person.
Okay.
Yeah.
All right.
Let's pretend.
Yes, let's pretend. Let's pretend that I know nothing, for example, about the Chinese language, which I don't. But I wanted to phish someone in China. I can simply pop open my favorite LLM and just simply ask it, translate this into everyday Chinese language, and it will likely be able to convert what I wrote in English, because I'm an English native speaker, into Chinese. And of course, if I were to feed that and cross-check that into, let's say, a Google or some other search engine, you could cross-check that just to make sure it's not saying any mumbo-jumbo. Then you can try to phish someone based on what you can find out about them and what you can scrape off of their company website, off of their social media and everything else. So that's how that fun is.
I wonder sometimes, with the increasing velocity, the how easy it is to do more and more convincing scams, and there's a range of different examples that could be shocking at how realistic they are. And you can understand how people may, click that link and add in information because it looks like it's the incorrect thing. The right thing, but they've done the wrong thing. and as we know, and I'm sure we talked about, but it's also just generally in healthcare, is that it's not too often that there's like serious nefarious stuff going on, people intentionally doing the wrong thing that then cause breaches. It's often when people let the guard down, or that there's basic kind of hygiene that hasn't taken place. I sometimes think, because every cybersecurity thing I go to, except for your thing that I went to earlier, that was different. That was cool. But so often we go to them, and it's the make sure you got multi-factor authentication.
Right.
Make sure you change your passwords. Like it's the same stuff. If we keep talking about the same stuff, but it keeps happening, like, is this just we're just going to have to keep doing this for the rest of our life? Like, how do we? Is there any? It's not like there's anything new in cybersecurity, but how do we keep it fresh front of mind to people? Because I feel like there's a fair bit of lethargy that can go on as well too. It's like,
right.
Yeah, I know, but then this stuff keeps happening.
But I have to say, there are new tools that are happening, and there are new means for securing your systems. As an example, you had mentioned passwords. Aren't you frustrated with passwords? I'm frustrated with passwords.
Yeah.
I mean, how many of us have encountered things like password lists? Like
Sure.
rockyou.txt and everything else.
Yeah.
I mean, you know that frequently used passwords, if your password is a common word or whatever, it could easily be cracked. I don't care if the 4 looks like another letter or something else. There are algorithms and programs to crack that right away. So the bottom line is we are now in a day and age where you can use mobile authenticator apps. You can use FIDO, U2F, hard keys to, essentially authenticate. And what we know about multi-factor authentication now in the day and age of AI and other threats is that you really have to do away with those passwords and ensure that both of your factors are secure, because your multi-factor auth is only as secure as each of your credentials, or each of your factors, I should say more specifically. So that has changed. Department of Homeland Security, at least in the States, they started to say you need to have phishing-resistant multi-factor authentication. They've been saying this, I would say, in the last 3 to 5 years. NIST has said similar things about multi-factor authentication. And now with AI, with deepfakes and all those ugly things that are happening, no longer is, for example, a voice call to your phone to say, here's your code, or text message safe, because, you have malware and other things that could eavesdrop. So there's that. So you need to definitely keep up with technology to fight technology, and also bad threat actors to essentially stay ahead. But the other thing that's happening too is the reason why these same darn mistakes keep on happening, whether it's in terms of social engineering or otherwise, is now reveal something maybe I shouldn't reveal, but I'll do it anyway. I'll be risky. Back in the day, I was, and I'm still a licensed attorney, so take it as real, folks. So back in the day, I was in private practice as an attorney.
Yes.
And I had one client who they had a bad breach, and we consulted with them. I said, what happened, da-da-da. And I said, here's how you can improve your cyber defenses and your training. And so I did that. And then 2 weeks later, they got breached again because they just simply did not improve anything. They didn't want to do the post-mortem analysis. They didn't do tabletops to test their defenses and see what kind of security tools they need in place. So you don't want to be like that client.
No.
They were a nice client, they were nice people, but being nice doesn't assure you any safety.
Yeah, no, and especially in such a high stakes industry, where it's on the any professional services like legal, but financial, but especially healthcare, is once that data is out, you can't replace. If your bank account is breached, you can replace money, but if your genomic sequence data is out there, it's kind of always out there now. So it's always high stakes. One thing I think about is in this world where we have increasing rate of innovation, a lot of cool new tools that need to be much more interoperable with each other. The real world of using a lot of these tools is that if you're dealing with a large enterprise that has a lot of security protocols around, they're doing all the right things to make sure everything is multi-factor authenticated out of every orifice, then you go to use tools that connect, and then they don't seem to connect because all the security is trying to stop it from connecting.
That's true.
So, and then people are like, oh, we'll just turn this off, or like, oh, we won't use that tool. So where do you find that balance of, as we've got more and more tools that keep everything super locked out,
right?
But we want to use all this cool, exciting, and I'm not even talking about, publicly, like, LLMs that are using publicly available, all the basic stuff. It's the practicalities on a day-to-day of whether you're in a clinic or you're wherever. The real world often means that if we lock everything down, we're not doing it like it's out of the box, which means then from a developer side, the tool's not being used as it should be from their perspective.
Right. Yeah. So here's some wisdom, I guess, in that regard, and that is even if you were to buy hundreds of millions of dollars in security tools, the best, the most bright and shiny objects, as it were, in terms of technology and security, it won't save you. Unless you actually take the time to configure it well and properly, and unless you test it, you're screwed. You are screwed. And we've seen that. We've seen organizations do that. And also the other thing is hospitals are not banks, are they?
No.
So why keep it all locked up like Fort Knox? We need the information. The information is the lifeblood of the organization. If a patient is in emergency care and they're facing possibly death, might go through 100 locks to get access to that data. And I think that if you're a new healthcare CISO that's maybe from finance, you might not necessarily understand that we're focused more on the availability of the CIA triad, not necessarily confidentiality. In finance, they have 6+ federal agencies, at least in the States, that are breathing down their neck, right? And each time there's a breach, it gets more difficult and more difficult. And that scenario you had described is absolutely the case. Although I could tell you that for various reasons, financial sector, sometimes it's not as secure as we think it is. It's another story for another time. But notwithstanding that, in terms of healthcare and hospitals, you need to really have a simple plan together, use things like the healthcare and public health sector cybersecurity performance goals, which we have in the States. Make sure that you're meeting those basic goals, make sure that you're meeting the essential goals, but do it as simple as possible, because otherwise your tools might be knocking each other out in the ring.
No, I love that. So earlier this week at HIMSS, I attended one of the sessions that you were participating in, and I saw there was a report, results of a survey that was completed recently. Talk to me a little bit about that.
Yes. The 2024 HIMSS Healthcare Cybersecurity Survey. We've been cranking out an annual survey since about 2006. It's almost been 20 years.
Wow.
I have not been on HIMSS staff that long, only maybe 12 years.
Okay.
But that's been a while.
That's pretty good.
That's pretty good. That's pretty good.
Yeah.
And they like me here, by the way. So I'll still continue to stay. All right. Notwithstanding that, all that kidding aside, the 2024 HIMSS Healthcare Cybersecurity Survey takes a look at everything from economics, budget, tabletop exercises. Are you testing actually what you're doing? And everything in terms of AI adoption, and are you securing it properly? Is there governance in place? And last but not least, you had mentioned, or you had implied, insider threat.
Yes.
That is so true. Very few people want to do harm. In healthcare, I mean, I don't mean to speak for you.
No.
I don't know you aside from this interview, just to be clear. No,
we met last year, Lee. Come on.
Yes, I'm sorry.
But I guess what happens in Vegas stays in Vegas, so...
But regardless, what I wanted to say is that with insider threat, you never know who the bad person is.
Yes.
I'm not a bad person. But maybe you might think I'm a bad person.
No.
But notwithstanding that, anyone has the potential to go rogue and to do physical or technical damage to an organization. And if you are inside an organization where you have trusted access, boom, that's your threat. So it could be negligent, or it might be malicious. And that's something that all organizations, I don't care if you're healthcare or a bank or otherwise, we all need formal policies in terms of insider threat management. We also need things like see something, say something. We've had unfortunate things in terms of people on occasion stealing information, or maybe they're disgruntled working in tech. And so they might occasionally sabotage information, but it really is something that we need to come up a level, as it were, in terms of protecting and safeguarding and having our eyes out on the lookout just to make sure there's nothing aberrational.
That's so true, because, we're all humans in the current climate, even whatever climate it was, when put under various pressures and external environmental factors, situations change. So ensuring everything is secure at all times, regardless of how cool your team is super important. Lastly, then, Lee, looking at all of the exciting innovations and also in cybersecurity and the cool new tools that exist, and people coming to HIMSS, that we're not short of sessions on cybersecurity and insights, and also providers with questions about it, and vendors also looking to provide solutions. Are there anything that's particularly catching your eye, or that is of most interest, or should be of the highest priority for attendees when they're looking through the lens of cybersecurity here at HIMSS?
Yes, absolutely. I can say that the sessions that focus on combining business and cybersecurity is very, very important. In fact, when Robert Herjavec was here to give a keynote on cybersecurity, as well as AI, he gave a pitch for business so that we in cybersecurity can essentially understand the business side of things, so that we in cybersecurity, if there's a ransomware attack, if there are other things, just by way of extrapolation, I'm just simply saying, we as cybersecurity professionals need to understand the world of business and economics so much more. And I think that that was inherent, or at least implied in his talk, because if we understand business, we're better able to support clinical care, the business of healthcare, and also the back-end operations. And to your point, we won't lock it down like Fort Knox. There'll be that nice balance. Other sessions, though, what I personally have gone to and what I think is the most valuable, the SANS executive cybersecurity exercises are very important, because you get to simulate what it is to be in a ransomware event and other kinds of cyber events that happen.
Yeah, right.
And other things relevant to, let's say, you do have a disaster. Let's say you have a flood, you have a fire. I was speaking to an Italian colleague just a few hours ago, and he had said, you know, Lee, if there's a fire, organizations, whether in Italy or elsewhere, you know what to do. When I was in Indonesia, you know what to do when there's a tsunami, and everything is clearly marked, right?
Yeah, right.
And the thing is, in terms of cybersecurity, why can't we get there? We need to have that mindset and essentially incorporate that, and maybe even incorporate best practices from the physical world into cyber. So I would say I would look at things that are cross-disciplinary when I look at cybersecurity, including the educational sessions here.
Hopefully you're enjoying this feature episode recorded at HIMSS 2025. Remember, once you're done with this episode, head over to our YouTube channel. There's a playlist featuring all of the discussions that I had here at HIMSS, because we couldn't fit them all into one podcast episode. All right, back to it.
I'm Ann Snowdon. I'm a nurse by training. With HIMSS, I am their Chief Scientific Research Officer, and I'm also a professor at an Ontario university and do a lot of research in digital health, what it achieves, and who does it achieve outcomes for.
Thanks, Anne. Great to chat with you at HIMSS again. Don't tell anyone, but it was probably my favorite interview last year, so I'm excited to.
Thank you.
No, what I found interesting last year, and I haven't gone into the detail and looked at every element of it, but I do feel like someone with your own experience and seeing what you've seen within healthcare, but also taking a practical lens and a clinical point of view as well. We're in an age right now here at HIMSS 25, a lot of cool, exciting potential and innovative technologies to apply, but still the same challenges in healthcare, but also some new challenges. So I'd love to get your take on, I guess, what's happened the past 12 months and what's really important right now.
Yeah, such a good question. It's actually many questions. The difference between now and a year ago, I would have to say, has little less to do perhaps with healthcare and much more to do with rapidly changing geopolitical environments, technology that's part of that, but not really. It's just another dimension. Technologies are rapidly advancing. Everything is about AI, which has great promise, no question. When I superimpose those things onto healthcare, then I think what's very compelling right now, when populations are under very high uncertainty, when there are economic pressures, we know health takes a hit. People's health, wellness, quality of life is challenged by those kinds of conditions. Technology is fascinating, interesting holds great promise. I am not seeing yet in global health systems those technologies being embedded and scaled and demonstrating very clear outcomes for people's lives, quality of life, and population health. The hope is we get there, but I'm not seeing it yet.
I've got a couple of trains of thought, and I'll go down one, which is there can sometimes be a disconnect between what's a commercially viable business model within healthcare and what certain populations within parts of the world really need from solutions. Hopefully it's not a triangle with an increasing amount of distance that as we continue to evolve, it's getting further and further apart. But what's your take on, being able to fund and build agency and advocacy for doing the things that really matter in healthcare through the lens of, well, hey, if we're going to get people excited about it, there's got to be money behind it, and it's got to be cool as well.
Yeah, it's a great question. And health, there's a very wide variability on those business models. And I think of those as what are the drivers of change and advances, whether technology is part of the change to drive particular outcomes for people or not. Could be.
Yeah.
Technology for technology's sake is, as Hal Wolf would say, very expensive. Put into old organizations makes a very expensive old organization, right? He shared that with us in the keynote. Yeah. But I think where it needs to start is, what does the population need? What are the population health challenges that any global health system must address in order to advance their mandate, regardless of the country, to help their citizens stay healthy, sustain their health, or improve their health, whatever those conditions may be. Being very clear on what population health or health outcomes an organization is seeking to achieve is fundamental, because until you figure out what success looks like, how are you going to know what technologies you need? So for me, it starts with, what is the population need that organization or country or region serves? And how are you going to define success? Because if you don't define it, you can't measure it, and then you don't know if you've ever achieved.
Yeah.
Then the technologies make sense as to, okay, we need this combination of technologies to engage with people, to help them help themselves be healthy and well.
Yeah.
And that's how the logic works for me. And that's where I see very high-performing health systems making some interesting progress.
Yeah. And there's obviously a plethora of challenges to solve and technologies to apply to those in whatever region that you're in. If I think, because I'd love your thought on other parts of the world and maybe even specifically the US, happy to take a pick. But I know in Australia, for example, continually increasing burden of chronic disease in areas where healthcare is not as accessible geographically or financially, and that's where we kind of need to address things at a federal level the most, because that's where assistance can be provided. But also it's getting the clinicians out there in the first place to be able to provide a quality of care. And there's tech that can assist in connecting people in remotely to do bits and pieces too. But I often feel like that even if we had all that infrastructure there and even the clinicians there, I often think about how much of a gap there still is in terms of, or we call it health literacy, but just how much people give a crap about healthcare, like themselves, and until they're sick, like then it's an issue. So I'd love to hear, like in other parts, I know that it's, there are some consistency across the world too, but I often sometimes think, like in the US, the US has just due to the size and the magnitude of it, what the US does has an impact on the other parts of the world too. So love your take on that.
Yeah, Australia is very, very similar to Canada. Both of our countries have large landmass, relatively small populations, and we all live quite far apart from each other, right? Yeah. So delivering healthcare under those conditions, we have the far north, which is fly-in only. You have the outback, right? That's a very unique population health challenge. Digital connectivity for rural and remote populations, exceptionally important, because quite honestly, I have not found a country yet who can be sure that every rural and remote community has access to the clinicians they need to help them when when they're sick or help them stay well.
Yeah.
So we have a global workforce shortage. It will more than double in the next 10 years.
Yeah.
We will not train our way out of that.
No.
So in order to leverage the strengths we have in our global workforce, digital has to be a driver of connecting people to provider teams they need to work with in order to manage their health and wellness.
Yeah.
I think that's one. A second area I think we haven't really spent enough time on is we're a very disease management system generally. To your point, you get sick, you don't feel very well, that's when you go and seek help.
Yeah.
Why aren't we leveraging these amazing technologies like AI and others to identify who's at greatest risk in our population?
Yeah.
And how do we wrap services and care around them or engage them to help make sure those risks never happen? That's a much less expensive model of care. So what kind of a system would be able to achieve that? Well, it depends on the drivers of the system.
Yeah.
You need the models of care that are proactive, data-driven, to know who you need to prioritize and is facing the greatest risk.
Yeah.
But then you need care delivery models and teams expert at helping people stay well.
Yeah.
That tends to be, in many countries, our public health system. And there are, in Canada, less than 2% of our global budget spent on public health. So perhaps what we're seeing is the need for that more proactive, preventive focus, helping people stay healthy and well, but empowered and fueled and enabled by digital tools and technologies that zero right in on those few resources we have in the workforce to focus on the highest risk populations and give them the tools to help themselves. Instead of waiting for the diagnosis and then it's much more expensive.
Yeah, absolutely. And it makes sense when we put it like that. But as you say, like in Canada, there's the 2% of the I think global health, the health spend that you mentioned in preventative health. And I guess the reason why a lot of the times there's not a heap of investment in the preventative health side is it's difficult to then quantify how successful something was if it didn't happen.
Exactly. How do you measure something that never happened? That's true. Very true.
So I guess, but as to your point, being data driven, the more data we can collect to be able to then demonstrate the potential, and then by having that clear return on investment, that can hopefully then drive some of these benefits in the preventative space.
I couldn't agree more. The other thing I think we forget is the consumer general public are out there. They use all kinds of different health apps and tools, smartwatches, sensors, you name it.
People look for stuff.
They are looking for stuff. Have you ever wondered why none of that stuff connects to a formal health system?
Yeah.
So you have a single source of truth with providers that understand, don't waste your time and money over here, but this tool and opportunity would be amazing.
Yeah.
And the population we probably should start with or spend more time focusing on is the chronic conditions you've mentioned. Right now, with a disease-focused system, we tend to have pathways for each diagnosis. Diabetes pathways, COPD, the usual. Where are the pathways that are multi-comorbidity, multiple diagnosis? We don't really have those. So what does that patient with 2 or 3 diagnoses end up doing? Dr. Google, maybe?
Sure.
A few apps and tools. So I think the consumer public's already there. They are managing their health and wellness, whether it's the best way, it's the way they have access, the way they think it's the best, or they have access to.
Yeah.
Maybe we need to look a little more closely at that preventive strategy in mobilizing the strengths we already have.
Yeah.
And by the way, it's different for different generations. What the millennials need on health and wellness is probably different than the baby boomers, different again from Gen Z, Gen X, because they all come at this with their very unique value proposition.
So, yeah, it's complex and very, very important point that you made around the multimorbidities and that no one has a single chronic disease usually. And it also needs to be, there's a lot of underrepresentation in terms of gender and the list goes on. So, but as you were saying that too, I also made me think about, I guess, where people get their information. They get their information from places they trust. And I guess one challenge, I'm not sure what the right answer is if we're looking at doing a system-wide kind of education campaign or helping people understand the right way to do things. Right now, I feel like if the government or if an authoritative body were to tell people what the right thing to do is, it probably won't land.
It won't go well. Yes, it won't go well.
Like, no matter where you are in the world right now.
Right.
Like it's and that's a challenge. So people go to places that they trust.
And part of what you're getting at, maybe going off a bit track, but part of what you're getting at is where health systems have been for decades is what I would call, forgive me, that patriarchal.
Yeah.
Do this, eat right, exercise this often, and you will be healthy. It's that telling people what to do. Maybe the opportunity, particularly with all the tools and technologies available, is help people make informed decisions.
Yes.
That's going to work best for their health goals rather than the goals a health system or a government or anyone else sets for them.
Yeah.
We are all, what it means to be human for me is the autonomy to make a decision. Maybe the education piece is, how do you know what data is accurate?
Yeah.
How do you know what the best options are for you, where you want to achieve outcomes rather than where a system or provider tells you where to achieve? And that might be where we haven't spent as much time.
I think you're right. Well, I know you're right because I think about there are large populations of individuals who are super interested in understanding more about their own body through diagnostic tests.
Yes.
And some of the tests that have been influenced to them may not be the most appropriate, may not be good intention, but it could be good intention, but could be an inexpensive, inappropriate use of the healthcare system. However, if we could get to a point where we're helping people get access to their information accurately, and so then they can then choose how they do that. I think we sometimes as systems we place too much emphasis on that very last bit, which is now this is what you should go and do. If we get all the way up to the point, then that could be...
That's the pathway.
Yeah.
If we were much more systematic and seamless to flow data and insights, it's not just the data. You have to make sense of what does that data mean for me? So it's about flowing data and analytics that a person could use to understand, is that helping me meet my goal or is it helping me make it harder to meet my goal? That's a lot of that. Some of that's data literacy, but it's also embedding the tools to help you know, gee, you have made huge progress in this, keep going.
Yeah.
Or you haven't made any progress. Your blood sugars have plateaued, and helping them understand what options are next. I think it's meeting people where they are.
Yeah.
And that's why digital health becomes now so important. We call it the person-enabled health system.
Yeah.
Start where that person is. What are the choices they should have in front of them to make, and what are the tools and decisions informed by data that we can help with them? That's what it builds trust. And it builds confidence that I do have a source, a provider team, a data that helps me understand, yes, this is right for me.
Yeah.
Rather than the pathway tells me I should do A and then B and then C.
Yeah. More focus on that scoreboard. I think everyone knows how to read a scoreboard in sports and everything, but if we don't know what the score is, because if you see a number that's here and it needs to be here, then you kind of work out the gap there. So I could chat for ages with you, Anne, but you've got a show to go to.
And you've got other people to chat with, so I understand.
But anyway, but lastly, to close it out, it's you've probably done a couple of HIMSS. Any other final key things you hope that people take away from this particular one in Vegas today? Things you would hope that attendees take away from HIMSS.
I would say given the very high uncertainty we see in the world today on many fronts, what I think people take away from HIMSS is this is a community to connect to learn from, to manage that uncertainty, and to progress towards making things better. Safety in numbers might be another way to say that.
Yeah.
But when you're facing high uncertainty, and as a clinician, when I used to work with patients and families, knowing there were people going through similar uncertainties with me and having people, communities, teams to learn from made it better, improved coping, offered what's possible, what's achievable. And that's what we need to focus on. What's possible, what's achievable, and how can I learn from others to achieve what goals I'm pursuing. I think that would be the takeaway for me this year.
Hi, Peter. My name is Christina Caraballo, and I am the Vice President of Informatics at HIMSS. Within my portfolio, I have a number of things covering everything from cybersecurity to digital health transformation and interoperability to our clinical informatics. We've also got a really cool strategy arm to make sure we're staying on top of everything happening in the industry and in order to be able to advise our members and the broader community on their digital health transformation journey.
Awesome. I've been looking forward to this conversation all week, Christina, because the interoperability space is super interesting globally, but in Australia in particular, a lot of transformation happening at the moment, a lot of focus on standards and making sure the right information is going to the right places, and a lot of talk about HIE, all these things that I assume are kind of your world.
Yeah.
Is that right?
It is, and I joke that my passion has always been in interoperability. It's kind of where I started in my journey in health IT. It's actually in consumer engagement before it was cool, working on data standards to make sure that people have access to their health information, which has been really, really fun work to do. But yeah, I do a lot of work in the standards community. One thing that many people may not know, or some do, is we work closely with IG International, which is an organization that works on having testing events and building profiles so that we can implement technology more easily into the ecosystem. Recently, the Australian Digital Health Agency joined IG International as a benefactor to help work with our tools and resources in order to get vendors really ready for implementing in the real world.
Yeah, well, that makes a lot of sense given the amount of focus we have on it back home in Australia. I'd love to understand, because I've had a lot of conversations here at HIMSS with a good mix of individuals, a lot from the vendor community, and quite often it comes up that an important part of what they're doing is that their platform or their solution or their services integrates in with all the different parts, because, you know, it takes a village and there's not one solution for everyone. If I was to think as them, like, and all this great work that HIMSS is doing, on standards and helping vendors create this, sometimes, what can happen is that when you're so deep in the weeds of building your own thing, you don't realize that you've got all this knowledge or insights or resources available to you. So what is it that's available to organizations that they can benefit from all the work that you're doing?
Yeah, and you said something really important, and it's about coming together as a community. We can't just build things for the sake of building them. I hate when we have standards that are super cool, or we build technology, but it's never used. So we have to work together as a community. That's one thing I love about HIMSS, is getting all of the people that touch IT together, where you're having conversations with the end users, the vendors, and the full community, so we can build solutions that are going to solve real world problems, which I think is essential. But when I think about the tools within the interoperability space and what we're doing within the Connectathon events and at HIMSS, we are really providing a place for vendors to be able to solve problems together. So we come with our community, we build the IHE profiles, which take the best of breed standards, put them into nice little packages. And I'm talking more simply and less technical, but put them into nice little packages so that vendors can actually test, and bring their solutions to market. And then we have testing events around the world. Our biggest ones are in Europe and North America. We just actually had our first in Canada, in Toronto, which was really, really fun. But basically, you have vendors that are able to test with one another in real time. Right. And so this is really, really important because they're working out kinks so that when they actually go to implement in real world environments, there's less trouble, or they don't have as many issues because they've already done the testing. And I've talked to so many vendors on the floor that are doing the testing. They're like, we get so much done in 1 week that we wouldn't be able to do because you're really like fixing things in real time, which is just absolutely amazing.
Hey, one thing I didn't mention before we spoke is that one of the many figurative hats I wear back home in Australia is on the board of the Medical Software Industry Association of Australia, and the work that the MSIA does is kind of advocating for the vendor community in navigating the ecosystem. A lot of that is trying to work with different bodies, whether it be government or also with standards, to then not just collaborate on the technical side, because there's a lot of value that comes from that in terms of, making sure these things work and all of the kind of technology bits work out. But technology is technology, and you can kind of, make that happen. Then you've got all the extra bits on top of it. So, if from back in Australia, it's one thing for, an authoritative body to say, hey, we need to build to standards because this is where we're going. But, every decision that a vendor makes, that's an investment in people and time and potentially technical debt as well, because, they don't want to go down one particular path of doing something and then it's like, oh, hey, by the way, we're not doing that anymore, or like we need to build it to this standard. And then you've got all the other elements of, in healthcare, there's a lot of human mushiness that's involved as well in terms of clinician requirements and the adoption and all these kind of bits. So where do you see, there's a lot of work we can do in standards to make the technology work, but then there's all this other stuff on top of it in terms of aligning with federal bodies and engagement with clinicians. All this, how do you kind of reconcile all this kind of stuff? Noting that we only have a couple of minutes.
Yes. No. And and that's a great question. And I think that's where you have to communicate together, right? Yeah. So we have to have these really transparent, open communication paths that we're talking to one another so that we can bring in the governments, we can bring in the hospitals, we can bring in the vendors, and we can have conversations on what's needed. It's often not only a technology problem too when implementing technology into the world. It's often culture or regulations or practices. And so we've got to solve those things too as well. So I often say, well, the technology's ready, but we're still trying to create the connected ecosystem. So, that really becomes where it's important with standards though, so that when we're ready to kind of really connect into different areas, we've got the path to do it. I'm really looking forward to the full digital health transformation that we're undergoing right now, where we're going beyond just hospital systems and thinking about the other places where we live, eat, work, and play. Also incorporating things like community-based organizations into the ecosystem, looking at the long-term post-acute care communities, looking at the emergency medical systems. Imagine if our whole ecosystem could just interconnect. And I'm thinking as we go through on a global digital health transformation, which is my new favorite word, or cluster of words, I'm really looking forward to see how we all progress together. And I love the communities that are coming together. Big thing to look at right now within the global community is development on the International Patient Summary, where so many countries are coming together right now to figure out what are those basic data elements that we need. need, and how do we share them across our borders and regions.
Christina, we definitely need to have more of these conversations in the future because we could do that for a lot longer. But lastly, in this chat, HIMSS 25, we're rounding out another great event. Interoperability featured a lot on a lot of the sessions. I didn't get to jump into all of them or anything, but what are you seeing like on the floor in speaking with vendors as we kind of close out this conversation, the trickiest challenges to address, or perhaps even some advice to those that are trying to navigate this labyrinth of information that's available and the problems to solve in the interoperability space, and tying it in with the why, like what are we actually trying to achieve?
Yeah, I mean, that's a great question. And one thing that I've been thinking about a lot is understanding where each of the different people within the healthcare ecosystem are on their digital journey, because there's such a disparity between many of the larger healthcare systems that are very ready for things like artificial intelligence, and then the rest of the world where they're maybe at the beginning of their digital health journey. And I think that when we look at the full ecosystem that I've talked about, we need to map out where each organization is on that journey so that we can help everyone kind of get there together.
I'm Ronan O'Connor, so I'm the Managing Director and Vice President of HIMSS in Europe.
Great to have you here, Ronan. And it's probably good timing, actually, where we've had a busy week here at HIMSS in the US. But I guess the party doesn't stop there. There's an ongoing rotation of in-person meetups I know that HIMSS do in smaller chapters, but also bigger events as well, and being a global community. So you look after that side of the world, is that right, for HIMSS?
Yeah, it's not just Europe, it's Europe, Middle East and Africa. But as you said, Peter, HIMSS is a global community. It's 125,000 members. And what we do at these gatherings is we just bring all the best practice that's happening around the world so that all like-minded people can have share the same information and understand how they can drive forward in digital health.
Yeah. Well, hey, look, what I've noticed going around to a lot of the booths and going into the sessions is that, strong contingent, obviously, from the US in terms of attendees, but good global community, good global presence, quite a few Australians as well, which is cool. But why then do you need a separate event for Europe? Because this year it's in Paris, right?
Yeah, absolutely. HIMSS Europe this year is in Paris in June, so lovely time of the year to be in Paris, 10th to 12th of June. But yeah, it's really important that we recognise that it's not one size fits all, and different parts of the world do things differently as well. So there's different regulations in place and how you drive forward on digital transformation. So take, for example, in Europe, you've got the European Health Data Space. And that's just been sort of announced. You've also got the AI Act, and you've got Cybersecurity Act as well. So whilst that's slightly customized to Europe, that takes the best principles around the world.
I'm curious too, looking into Europe and understanding the health system a little bit more. It's kind of like, this is a weird analogy here, but I liken Europe to almost like allied health. So in healthcare, allied health sometimes this is what allied health needs. But in allied health, you've got physios, you've got and then you've got dozens and dozens of other kind of modalities. And sometimes it feels like, yeah, that might work for this one, but maybe not for that one. How do you go about pulling together the needs of, there's the commonality there of, yes, the European region, but then every country's got their own, unique requirements in terms of digital health literacy and the even just needs through HIMSS general. I'm fascinated in what it's like, corralling all that together.
Yeah, well, it's generally, we're fortunate of the fact that we've got a very, very strong membership. So our membership advise us in relation to how we sort of drive forward in that regard. So, for example, in Europe and the Middle East, we've got something like 12 communities. So communities are sort of geographical groupings of like-minded people. So whether that is CNIOs, whether that's CIOs, whether that's others working within digital health transformation, policymakers, vendors, they come together in communities which we support as an organisation. So in Europe, we meet with all those communities and they help to shape and form the content of the gathering that we're going to have in Paris in June.
Yeah.
So it's very much bottom up. and then taking the sort of the global best practices and bringing that together to host what we say is that the number one learning experience across Europe.
And what I've learnt too is that for HIMSS Europe, it's whilst super relevant for obviously for people who are in that region, there's you're expecting a bit of a global contingent coming in for the event as well. Is there something for everyone there?
Oh, 100%. Yeah, whilst 50% of the participants will probably come from sort of the host country, the other 50% will come approximately from about 70 or 80 different countries around the world. And that's just based on previous conferences. So that was the figure in Rome last year, with 78 different countries represented.
Interesting. And you're no stranger to healthcare in different parts of the world. Tell me about kind of how you've seen things progress over the years in terms of what the industry needs, given where we're at now in terms of rapid scale of innovation, new technologies available, but all the challenges around regulation, cost containment. I mean, there's a lot of plates to spin in different parts of the world.
Yeah, it is. And I've been fortunate. I've worked certainly within the UK, where I'm currently based now, but I also had the privilege of spending 5 years in Australia, where it's great to be talking to you, Peter. And I had a fantastic time there as well. And the privilege of working for HIMSS is the fact that I get to support many other governments in their digital transformation. But the one thing I would say is that the challenges are common. And this is why HIMSS has got the mantra around sort of people, process and technology. That is, as I say, it's a mantra, and it's something that it can be applied at every corner of the world. But the challenges that everybody faces are really around the whole acceleration of digital health transformation. So it was moving fast before the pandemic. Post-pandemic, it has accelerated even more. It's absolutely going at a crazy pace. And particularly in Europe, what I mentioned around the new policy initiatives in relation to artificial intelligence. Artificial intelligence is important. Here today or here this week in Vegas, you struggle to find a stand or a booth that isn't talking about artificial intelligence. You don't sit through a single session without anybody mentioning artificial intelligence. And certainly artificial intelligence will be a key component of the Paris conference in relation to how that's disrupting healthcare, but ultimately how it's complementary to everything that we do going forward.
And lastly then, so as we pull the banners down here at HIMSS Global in Vegas and get ready to head off to Paris for HIMSS Europe, why? So, there's so many different individuals doing different things in healthcare, everything from those that are in policy and government right down through to the frontline clinicians that are doing the healthcare and everything in between. I mean, who's it really for? Where in the world, are people from that should be attending, and why should they go?
Yeah, well, look, I would very much talk about sort of the region that I'm currently working with in the moment. So I would encourage anybody who is interested in learning, interested in connecting and collaborating, and more importantly, interested in driving change in their local health system to come to HIMSS Europe in Paris in June, the 10th to the 12th.
Hopefully you enjoyed this feature episode of the Talking HealthTech podcast recorded at HIMSS 2025. Now that you're done with this one, head over to our YouTube channel because there's a playlist featuring all of the discussions that I had here during the event because we couldn't fit them all into one podcast episode. And hit follow or subscribe on your platform of choice so the algorithm knows to share it with even more people. Thanks for your support.